Sarah Warren, The Pain Relief Secret: How to Retrain Your Nervous System, Heal Your Body, and Overcome Chronic Pain. Chronic pain affects millions of people, and it can have a significant impact on their mental health and quality of life. In The Pain Relief Secret, Sarah Warren presents a holistic approach to manage and overcome chronic pain by focusing on retraining the nervous system and relearning proper movement habits. The book delves into the causes and consequences of chronic pain, the role of stress, anxiety, and depression, as well as various treatment options and their effectiveness. By employing clinical somatic education, readers may experience relief from pain and long-lasting improvements in their overall well-being simply by correcting muscle patterns and understanding the mind-body connection in pain management.
Chronic pain, understanding it and finding relief. Chronic pain affects millions of Americans and costs billions of dollars annually. Western medicine treats the symptoms of chronic pain but not its underlying causes. The way we move can cause or alleviate pain. Surgery is often an expensive and ineffective solution for chronic pain, while physical therapy can be a more successful and cost-effective approach. People suffering from chronic pain can take control of their lives by changing their patterns of movement and relearning how to move their bodies. The link between stress and chronic pain. Chronic stress can lead to physical changes in the body such as high blood sugar, decreased immunity, and more pain. How you perceive stress determines how your body responds to it. Chronic stress can cause anxiety and depression. Alleviate anxiety and depression naturally by engaging in talk therapy, taking control of your life, doing regular exercise, and taking time to relax. Most of these strategies will improve your immune system function. The power of muscle memory. Our brains create and shape neural pathways when we learn to move. The more we repeat physical actions, the stronger our synaptic connections become, leading to the development of muscle memory. Motor learning progresses slowly, but visualization techniques can strengthen it and help us tackle more complex tasks. To test the extent of our muscle memory, we can try performing daily activities with our non-dominant hand. Desk job strain. A desk job can cause strain on muscles, leading to discomfort. Over time the body gets used to this position, so it becomes more comfortable. However, this causes the muscles to contract more, resulting in a cycle of discomfort. It is imperative to be mindful of body posture and correct any damaging muscular patterns before it becomes an involuntary response. Pain relief methods. There are several treatment options available for relieving pain, each with its own benefits and drawbacks. Stretching only lengthens muscles and can decrease muscle performance. Massage, on the other hand, reduces muscular tension and improves flexibility. Chiropractic treatments can cause adverse effects, including headaches, dizziness, stroke, and even death. Physical therapy is useful for acute pain patients, while medication can be addictive and cause rebound pain. Surgery is an appropriate option when other methods fail. Joint replacement surgeries have high success rates when combined with movement re-education techniques. The effects of poor posture. Poor posture can lead to various physical dysfunctions, including hyperkyphosis, and affect people of all ages due to the modern overuse of electronic devices. Moreover, one's personality can affect their posture as well, with open body language conveying confidence and rounded posture conveying shyness and lack of confidence. Do you know that poor posture is not just a matter of appearance but also affects our physical being? This book explains how poor posture can cause various physiological dysfunctions, including hyperkyphosis, low back pain, nerve compression, and even headaches and teeth grinding. According to research, the prevalence of hyperkyphosis among teenagers and people in their 20s and 30s has risen due to the overuse of electronic devices. An Australian study found that neck flexion and forward head posture persisted even when participants weren't using electronic devices, suggesting habitual contraction of abdominal muscles and an increased risk of hyperkyphosis. In addition, the book also discusses how posture can be related to personality. Confident people have an open body posture with a straight back, hands on their hips, head forward, and an open chest and abdominal region, while shy and less confident individuals tend to have rounded backs, concave chests, and hold their heads down. The effects of posture on personality and social interaction are also explored. So next time you catch yourself slouching, remember how bad posture can negatively impact your well-being, and straighten up. Move smarter, not harder. Sports and repetitive movements can lead to pain and injury. Clinical somatic education can help keep muscles flexible and joints moving freely to benefit athletes of all ages. Varying workouts and practicing movements slowly can also reduce pain. Regular exercise, proper ergonomics, and smarter movements in daily activities can improve spatial awareness and posture, reducing the risk of developing chronic pain, heart disease, and cancer. Athletes develop muscle memory through repetitive muscular patterns, making them more prone to pain and injury. Sports or other disciplines relying on repetitive motions on one side of the body can exacerbate this problem. Excess muscle tension, fatigue, and structural breakdown are likely to occur due to the sheer overuse of one side of the body. Young athletes are at higher risk because their bones, muscles, and connective tissue are still forming. However, if children play 2 or 3 sports, they can reduce the likelihood of suffering injuries by switching up ingrained muscular patterns through a variety of workouts. This holds true for adults as well. Clinical somatic education can benefit athletes of all ages by keeping their muscles primed, flexible, and their joints moving more freely. To enhance bodily awareness, try listing every sport and physical activity you've done, slowly practicing each movement from your sport or activity, thinking back on every injury you've had, and varying your workout routine to avoid pain. Relax and move naturally, stand up, look downward and let your limbs relax. Walk slowly and notice differences in tension from this walk compared to your regular walking pace. Try speeding up to see what happens. Regular exercise brings countless benefits. It improves cardiovascular fitness, muscle strength, bone density, brain function, and mental health, and reduces the risk of developing cancer and heart disease. It also reduces rates of chronic pain, improves circulation, and helps maintain muscular and joint flexibility. Exercise increases spatial awareness and improves posture. Moving smarter, not harder, is essential when it comes to performing everyday activities. Avoid gripping your steering wheel when driving or pounding your keyboard when typing. Instead, do your daily activities with lighter, more relaxed movements. Improve your ergonomics to alleviate pain by designing and arranging objects to use them more efficiently and safely. Use a headset when talking on your cell phone rather than cramping your arm. Set up an ideal computer workstation, where your screen is in front of you and at eye level, sitting in a flat chair that supports your back, keeping wrists neutral and flexible when typing, and having enough space under your desk to stretch your legs. Overall, it is crucial to take control of your well-being and not wait to get better or resolve pain overnight. Incorporating proper ergonomics, regular exercise, and smarter movements in daily activities enhance bodily awareness, reduce the risk of chronic pain, heart disease, and cancer, and improve posture and spatial awareness.
In conclusion, The Pain Relief Secret is a comprehensive guide to understanding and managing chronic pain, offering effective alternatives to conventional treatment methods like medication and surgery. By examining the physical, mental, and emotional factors contributing to chronic pain, readers can retake control of their lives by changing their movement habits, reducing stress, and improving their overall health. The book encourages readers to become more aware of their body and patterns, as well as practice a variety of exercises and techniques to promote healing and well-being. With dedication and patience, suffering from chronic pain can be significantly reduced, if not eliminated, by adopting these healthier habits and incorporating clinical somatic education into one's daily routine.